Hyperadrenalism means oversecretion of adrenal hormones. Now, adrenal hormones are released from the adrenal gland, and adrenal gland is present at the top of the kidney. You know that adrenal gland is divided into two parts, the adrenal medulla and adrenal cortex. Both of these parts are involved in releasing different hormones that perform specific functions inside the body. To learn the anatomy of the adrenal gland in detail, you can visit the anatomy course section on sqadia.com and learn the anatomy in detail. And also you can watch physiology lectures to learn how the hormones are released and how they function, what are their function, and how they are performing their role in the stress system of the body, in controlling the sympathetic and parasympathetic system of the body. Now, basically, there are the three main hormones that are released from the adrenal cortex. Cortex basically release the cortisol, the aldosterone, and the androgens, whereas the medulla is involved in releasing the epinephrine and other catecholamines. Now, depending upon these hormones release, there are certain conditions that are due to the high levels of these hormones, like the cortisol, aldosterone, and other androgen. Here in this section, in this lecture, we are going to study about the diseases that are due to the adrenal cortex, the hormones that are released by the adrenal cortex. That's why we are saying that we are going to study about the hyperadrenalism. Now, there are three main diseases in this category. The first one is the Cushing syndrome. Now, Cushing syndrome is also known as the hypercortisolism. Now, as the name is indicating, hypercortisolism. So this Cushing syndrome or hypercortisolism is due to the high level of the cortisol in the body. And this cortisol is the major glucocorticoid among all others. Now, the reason can be any disease or any genetic or exogenous factor can be there, causing an increase in the level of the cortisol hormone that lead to the symptoms of the Cushing syndrome, like the puffy face and enlarged skull. Moon face can be the prominent symptoms, and rest of the symptoms we will discuss in detail later. The second condition that we will study in our lecture today, and that is due to the high level of aldosterone in the body. It is known as the hyperaldosteronism. Now, you know that aldosterone is very important enzyme as it is involved in the regulation of the renin-angiotensin system. It causes the retention of the salt in water, involved in the blood pressure regulation as well. So when there is a high level of this aldosterone, obviously the system of the body will be disturbed, and the body will lead to a condition known as the hyperaldosteronism. We will talk about it in detail later. And then third one is the adrenogenital or viralizing syndromes. Now, you know that most of the androgens are released from they are formed inside the ovaries and the testicle, and they are released from there. Mostly the cholesterol is used in the formation and release of these hormones. However, there are some weak androgens, you can say, or a little amount of the androgens are also being produced in the adrenal cortex and released from there. When there is an increase in these androgen level, this lead to adrenogenital or viralizing syndromes. We will also discuss about this condition. So basically, in this lecture, we are going to cover the three main conditions: the Cushing syndrome, hypercortisolism, the hyperaldosteronism, and the adrenogenital syndromes.